This is Outside Source on BBC News for viewers in the UK and around the world. We are, as always, covering all the very latest coronavirus developments here in Britain and also globally. Our main headlines. In the United States, the chair of the influential Senate Intelligence Committee, Richard Burr, steps down while he's investigated for alleged insider trading during the coronavirus pandemic. Meanwhile, a former top official turned whistleblower warns Congress that the window of opportunity to deal with coronavirus is closing.
I knew that we were going to have a crisis for our healthcare workers because we were not taking action.
The first cases of coronavirus reached the world's largest refugee camp, Cox's Bazar in Bangladesh. A new test designed to check whether people have had the virus gets the green light in England's health service after a rollout in the US and Europe. Hello and welcome to the programme. We have had two big developments in the United States today, both focusing on who knew what and when in terms of the US government's response to coronavirus. The first is testimony given by the whistleblower Dr. Rick Bright, who until April led the US agency that was spearheading research into a vaccine. He's told a congressional committee today that the US will face an even worse coronavirus crisis unless it develops a better plan to fight the pandemic. And then in just the past few hours, we learnt that Richard Burr, one of the most senior Republicans in the Senate, has stood down as chair of the all-important Intelligence Committee. He is being investigated by the FBI over allegations that he sold off substantial amounts of stock after he was briefed about the likely spread of the virus. Here's Anthony Zerka in Washington.
You have to go back to February when Richard Burr, as the chair of the Intelligence Committee, was receiving daily briefings from the intelligence community about the coronavirus, its spread through China, its threat to the United States. In the beginning of February, Burr wrote a public op-ed in a newspaper saying that the response was going to go well, being very optimistic about how the U.S. was going to handle it. However, on February 13th, he began selling his stocks anywhere from $600,000 to more than $1 million of stocks in industries that were going to be particularly affected by the pandemic, things like travel and shipping and restaurants. And then after that, he was said privately to some people that it looked like the pandemic was going to be as bad as the 1918 influenza pandemic. So the accusation here is that he used the briefings, the information he was getting as chair of the Intelligence Committee to educate his decisions on stock, and was able to dump stock in advance of what would be a massive U.S. stock market drop that began at the end of February and stretched into March. That's a violation of federal law. There was a 2012 law that prevented members of Congress from using their non-public information to benefit or to give them some sort of guidance on their stock actions.
Meanwhile, in that other development, President Trump has dismissed the whistleblower who used to head the US agency researching a vaccine for COVID-19 as a disgruntled former employee. Rick Bright has told Congress that he was ousted from his job for questioning the president's touting of an anti-malaria drug as a potential treatment. Here's Dr. Bright.
I believe part of the removal process for me was initiated because of a push back that I gave when they asked me to put in place an expanded access protocol that would make chloroquine more freely available to Americans that were not under the close supervision of a physician and may not even be confirmed to be infected with the coronavirus. And when I spoke outside of our government and shared my concerns for the American public, that, I believe, was the straw that broke the camel's back and escalated my removal.
Well, here's President Trump speaking earlier.
I don't know him. I never met him. I don't want to meet him. But I watched him, and he looks like an angry, disgruntled employee who, frankly, according to some people, didn't do a very good job.
The president there. Well, the United States is the epicenter of this pandemic. There are more than 1.4 million cases of coronavirus in the US. Nearly 85,000 people have died from COVID-19. It's by far the highest number in the world. Well, here's Gary O'Donoghue on Dr. Bright's testimony before Congress.
A lot of his criticisms directed particularly at his bosses at the Department for Health and Human Services talking about the warnings that he'd issued them, not just on swabs, but on N95 masks, on getting samples of the vaccine from China early enough. And he said effectively that the whole process of getting the country back to normal and needless deaths will have happened because of those delays. He was also one of those people pushing back on the president's sort of slight fetish, if you like, with hydroxychloroquine, which the president was pushing for a long time. People should take it. You know, what have you got to lose, if you remember the president said. And he said, Rick Bright, there was no safety evaluations done of that and that it wasn't something that he would support. And as a result of pushback on things like that, he was getting frozen out of meetings. And he was a senior official at HHS in charge of the vaccine development issues. He was eventually fired from the job.
Our thanks to Gary there for that update. Now, England has become the latest country to approve the use of a blood test that can tell whether or not you've had the coronavirus. This antibody test has been developed by the Swiss drug company Roche and has already been approved by the European Union and also the United States. It will be available in England once the NHS has agreed a price. Boris Johnson has described having a reliable antibody test as a game changer, but there are still questions around whether a positive antibody test means that a person is in fact immune. Well, here's the UK's Deputy Chief Medical Officer, Jonathan Van Tam.
It's going to take us time to understand whether the antibodies, in all cases, protect against infection. And you can't speed up the answer to that. You have to carefully study people who've recovered, people who you know have got antibodies, and follow them and track them and see if they become reinfected.
And here's our medical correspondent Fergus Walsh on what the new antibody test involves.
Shot scratch.
It's what millions of Britons want to know. Have they already had coronavirus? Now it's possible to find out for sure with a blood test. It has to go through lab analysis. This can be done by hand, like here at Imperial College London, or in an automated process, like a new highly accurate antibody test approved for use in the UK. If you get infected with coronavirus, your immune system starts to produce antibodies. These become part of your immune system's memory. So if you get exposed to the virus again, they should attack it. But how much protection they'll give and how long that immunity will last is unclear.
For some coronaviruses, we know that that protection can fade, and we know from experiments many years ago, for example, that it's possible to reinfect individuals with exactly the same coronavirus maybe a year later, even though they developed antibodies to start with. And so we have to be careful to assume that any antibody will last a long time.
The swab goes right to the back of the throat, both sides by your tonsils.
Remember, it's a swab test like this which will show if you're currently infected with coronavirus.
Thanks very much.
So this remains crucial in preventing the spread of the virus.
But there are still questions around how many people in England have been infected by coronavirus. And the Office for National Statistics estimates that on average, 1 in 400 people in England have COVID-19 after monitoring 11,000 people who carried out swab tests over the 2 weeks up to the 10th of May. Well, here's Pete Benton from the ONS explaining what the survey showed.
So we've published some results today based on swabs from about 10,000 people in just over 5,000 homes. And what that tells us is about 0.27% of the population, so about 148,000 of us, have coronavirus kind of at the moment or over the last 2 weeks. Now, it's a survey and we have to gross that up to be representative of the whole population. And when you do that, there is a bit of uncertainty. But we're pretty confident the true number is somewhere between 94,000 and 222,000, but it's about 148,000 we think that have coronavirus now.
Well, new research also suggests that people who don't show symptoms once infected with this virus won't develop antibodies for it. The study focuses on a small village in northern Italy, which was hit early on by the virus and is led by a professor at Imperial College London.
We have tested now in the Veneto, in our lab, more than 150,000 people, and we have data for about 8 1,000 positive individuals, and we start to observe that individuals who have been asymptomatic, they do not develop antibody. And also people who have very mild disease, again, this is very interesting. We do know why some individuals develop a mild disease and others not. And this is why we want to do we are doing the genetic testing of the entire population, because we want to see if some genetic variants are associated with a natural resistance to the virus. It's not surprising, because if you don't make tissue damage, so if you don't have symptoms, of course you don't stimulate the immune system and you don't develop antibody. Now the question is why these people do not develop symptoms. What is the reason of their natural resistance to the disease?
Still so many questions when it comes to this disease. Now, the first cases of coronavirus have reached the world's largest refugee camp in Cox's Bazar in Bangladesh. The camps are home to more than 800,000 Rohingyas who fled persecution in Myanmar. Officials are now trying to trace anyone who might have come into contact with those who have the virus. Our South Asia correspondent, Rajini Vaidyanathan, reports.
For weeks, the world's largest refugee camp's been in lockdown. Now, the news they've been dreading. Coronavirus has finally arrived. Officials say 2 cases were identified in the camps, one Rohingya refugee and a local Bangladeshi. Both have been taken to a nearby health facility. For the refugees who live in the cramped and congested dwellings where social distancing is tough, there's fear.
We are very afraid of coronavirus. The camps are crowded. I'm worried that many people could die from COVID-19.
Healthcare facilities in the camps are basic, with no ventilators. Charities are expecting the number of cases to skyrocket.
It's very difficult to say, but given the cramped hygiene and the sort of slow testing that we have, it could be anywhere in sort of thousands, hundreds. And it's very likely that what we'll see is an explosion in cases in the camps in the coming days.
Officials are currently trying to trace hundreds of others who may have come into contact with the 2 confirmed cases. The Rohingya, who fled persecution in Myanmar, now face a new deadly threat in the form of coronavirus. Rajini Vaidyanathan, BBC News.
Do stay with us here on Outside Source. Lots still to come. We'll be taking a look at the UK's care home crisis, where a quarter of all known deaths from COVID-19 have occurred. The swearing-in of Israel's new unity government has been postponed until Sunday. This is the latest twist in a political standoff that has lasted more than a year. Here's Yolande Nell.
Benjamin Netanyahu remains Israel's prime minister, despite facing corruption charges. He and his main rival, Benny Gantz, agreed to become coalition partners after 3 inconclusive elections in a year.
The coronavirus certainly played a role by creating a feeling of emergency, a feeling that politics need to be relegated to a back seat.
Last week, Israel's High Court ruled Mr. Netanyahu could lead a new government while he's on trial. And it didn't block the power-sharing deal that will see Mr. Gantz become Prime Minister in 18 months. Some Israelis are outraged on both counts. They've joined large protests, keeping to social distancing rules. But others are glad to avoid yet another election.
Welcome back. You're watching Outside Source live from the BBC. Our main story, the chair of the influential Senate Intelligence Committee, Richard Burr, is stepping down while he's being investigated for alleged insider trading during the coronavirus pandemic. In the UK, the government has been defending its commitments to protecting people in residential care homes for the elderly in England. Around a quarter of all known coronavirus deaths in Britain have happened in care homes. Ros Atkins has been looking at this issue.
Well, the statistics around care homes in England are stark. Thousands have died, tens of thousands of people have been infected by COVID-19. And while the human cost is indisputable, the reasons for this tragedy are increasingly the front line in a battle over where blame should lie for the UK's exceptionally high coronavirus death toll. As you can see here, the widely used Johns Hopkins University virus tracker lists over 33,000 deaths in the UK. That's the second highest in the world, though I should note that the UK government has recently started to question the validity of country comparisons. The story of the care home crisis goes back to March. During that month, the UK's overall COVID-19 cases went from 40 to over 25,000. Also in March, we know some patients were discharged from English hospitals into care homes without a test for the virus. The question is, why did that happen? And in addition, did it contribute to the national surge in infections? Now, you may have seen this recent Daily Telegraph article, which quotes an email from a London doctor who writes, "We discharged known, suspected and unknown cases into care homes, which were unprepared, with no formal warning that the patients were infected, no testing available, and no PPE to prevent transmission. We actively seeded this into the very population that was most vulnerable." Now, the NHS denies discharging people who tested positive into care homes, and the UK government has both consistently defended its support of care homes and denied any suggestion that it deliberately allowed the virus to spread. Questions, though, were certainly raised on March the 13th when the UK's chief scientific advisor, Sir Patrick Vallance, said this.
Our aim is not to suppress it completely. Also, because most people, the vast majority of people, get a mild illness, to build up some degree of herd immunity as well, so that more people are immune to this disease and we reduce the transmission. At the same time, we protect those who are most vulnerable from it.
Well, that caused a huge furore. The Atlantic magazine called it, as you can see in this headline, herd immunity, the herd immunity debacle. And the day after that interview, Health Minister Matt Hancock wrote an article in which he said, "We have a plan. Herd immunity is not part of it. Our goal is to protect life from this virus. Our strategy is to protect the most vulnerable." Now, there can be no dispute, though, that three important things did happen in March. First of all, the UK abandoned any efforts to test, track and trace the virus. That approach has proved very effective for South Korea and in Germany too. But Boris Johnson recently admitted that transmission among individuals in the UK exceeded our capacity. In other words, in March, for whatever reasons, the UK just didn't have the tests to do this. The second thing is the UK locked down later than many of its European neighbours. On March the 12th, Patrick Vallance, Chief Scientific Advisor, said, "If you tell people to stay at home too early, they get fed up with this at the very point where you need them to stay at home." Well, many questioned this reasoning, but for right or wrong, and for a range of reasons, the UK decided to lock down on March the 23rd, after many other countries had done so. The third thing is, we know that there were patients moving into care homes without tests. A senior figure from the health service in England has said there was no instruction to systematically test every single patient due for discharge into social care until the 15th of April. So in March, we have a situation where test, track and trace is not a goal, where the lockdown policy is out of sync with many other countries, and where there was no instruction to test everyone being discharged into a care home. Now, as I've been saying, the government has defended its decisions throughout, but questions continue to be asked. This was the House of Commons yesterday.
On Sunday, the Prime Minister said that we need to rapidly reverse the awful epidemic in our care homes. But earlier this year, and until the 12th of March, the government's own official advice was, and I'm quoting from it, "It remains very unlikely that people receiving care in a care home will become infected." Yesterday's ONS figures showed that at least 40% of all deaths from COVID-19 were in care homes. Does the Prime Minister accept that the government was too slow to protect people in care homes?
Prime Minister.
No, Mr. Speaker, it wasn't true that the advice said that, and actually we brought the lockdown in care homes ahead of the general lockdown.
But the advice referred to by Keir Starmer was the government's advice until it was withdrawn in mid-March. And at that point, it had become clear that the assumption that the virus was not spreading widely in the community was incorrect. And so, for a time in early March, the virus had been spreading in care homes when the government advice was that it wouldn't be. Now, we can't know the impact of all of these factors, it's too soon. But we do know that this was a sector that was already under extreme pressure. Here's the BBC's social affairs correspondent, Alison Holt.
I think what this has done is it shined a light on a system that was already under huge pressure. It was already in crisis. And in the most upsetting way, coronavirus has made the case, displayed the need for reform, which has been talked about for such a long time.
Well, this week, the government has reiterated its commitment to protecting those in care homes in England. And today it was asked about the issue at the Daily Briefing.
In the vast majority of care homes, COVID-19 hasn't been reported at all. However, it certainly is the case, and we've seen these figures from the WHO, who say that in Europe as a whole, over 50% of deaths have taken place in care homes. Not so in English care homes, the figure's been about 25%.
Well, along with Alison Holt, another BBC journalist who's looked at the care homes issue in detail is Lewis Goodall from Newsnight. I asked him to record what he thinks the government's biggest challenges are in tackling this issue.
The British government has got some really big decisions to make, both short and long term, with regards to social care. In the short term, it's got to try and get control of the outbreak of the disease in British care homes. It is so severe there, it is so profound that it's pushing the overall R rate for the country up. So it's all about PPE, it's all about sick pay for carers, because some are going in even when they're asymptomatic. It's also about ensuring you're not getting COVID positive patients being discharged from hospital into homes, which has been happening too much. Longer term, though, it's all about the structural solutions. The British care model has effectively been Victorian for a long time. It's been the neglected second child of the British welfare state. Governments of all colours have ignored it because of money, but if they don't sort it out quickly and soon, we could be here very soon all over again when the new crisis hits.
Well, do follow Lewis and Alison Holt on Twitter for their reporting on the care home issue.
And our thanks to Ros for bringing us up to date, bringing that all together for us. Let's update you on other parts of the world in regards to coronavirus. First, let's start with Yemen. There are reports of a dramatic rise in the number of people dying with coronavirus-like symptoms in the southern city of Aden. Quoting official figures, Save the Children says that there have been at least 380 deaths in the past week. According to the charity, some health professionals lacking personal protective equipment were refusing to go to work. Several hospitals have closed and people are dying because they can't get treatment. Turning now to New Zealand, where people have been getting a sense of what it's like to get back to business as lockdown there is lifted. Thousands of firms have reopened, with shops and restaurants welcoming customers for the first time since March. Well, although the risk of transmission is now said to be very small, people are still being urged to follow strict social distancing rules. Well, while New Zealand has been praised for its decisive action on coronavirus, the government is facing criticism over a new law which gives police greater powers to arrest those breaking social distancing rules. Here's Bryony Soudan.
The law was rushed through on Wednesday before the restrictions were eased around the country, and what it means is that these lockdowns, the quarantines, police giving fines for flouting social distancing rules, that can continue, but with more ease. Now, the biggest thing and the biggest change is that police will be able to enter people's homes if they have significant reason or grounds to believe that people are breaking the rules. Now, what that means in practice is that if you're having a party or there's loud music, you can probably expect police at your door without an arrest warrant. The other big thing is that the Health Minister can now effectively designate any government employee an enforcement officer, which means they can go into businesses and check that businesses too are complying with these social distancing rules, and if not, they can be shut down too. There's been a lot of criticism. Many believe that this infringes on people's civil liberties. The opposition has called it a step too far. Amnesty International also has urged the government to re-look at this law and to review it in the coming weeks. The government, though, it's defended this legislation. It says that New Zealand is facing unusual times, that this is urgently needed to fight COVID-19 and was necessary to be able to lift the restrictions around the country, and it will also give them the power to ramp up its response should there be any more cases that come to light in the next few months.
And in Finland, school children have returned to their classrooms after 8 weeks of lockdown. Strict social distancing rules are in place with staggered break times. Finland has recorded 284 deaths, more than 6,000 infections, lower than its neighbouring Nordic countries. And what do you make of this attempt to maintain social distancing? This is in a cafe in Germany just outside of Hamburg. The cafe owners are asking customers to wear swimming noodles on their heads. This was posted on the cafe's Facebook page. Give me a call, a practical idea. Let us know. Our hashtag is BBCOS. I'm at BBC Kasia Madeira. Thanks as always for joining us here.